Greetings and welcome to the Cancer Interviews podcast. I'm your host, Bruce Morton. Compared to other types, we don't hear a whole lot about kidney cancer, but on this segment, we're going to do some learning as our guest not only survived kidney cancer, but is doing what she can to help others on their kidney cancer journeys. She is Marissa Willis of Blue Springs, Missouri. And Marissa, welcome to Cancer Interviews.
Hi, Bruce. Thank you.
Now, first, we'd like to learn a little bit about your life exclusive of your kidney cancer journey. So if you would, tell us a bit about where you're from, what you do for work, and when time allows for fun, what you like to do for fun.
All right. Well, I'm from Blue Springs, Missouri. That's just outside of the Kansas City area. I work full-time. I'm in the human resources field, and I've been doing that for a little over 20 years now. For fun, I love to travel when I can and do that with friends and family. Spend time with my husband and my two sons, and just doing anything we can to be outside and go and do things, kind of get out of the house.
That sounds like a pretty healthy, active lifestyle. Would you say that that's how things were for you prior to your diagnosis?
It was very, very active, just kind of going all the time like a lot of families.
But at some point, something didn't seem quite right. What was not quite right, and how did that manifest itself?
Well, it was actually 9 years ago in April 2013. I very active, working out a lot, eating healthy, but noticed something on my left side just didn't quite feel right. It was actually a little bit of an odd sensation under my skin. Not so much pain, but just a really weird sensation. I thought maybe I'd pulled a muscle, or worse yet, had some kind of a hernia, from working out, too much. Just really didn't know. So on a Sunday afternoon, found myself at an urgent care to get checked out.
And what did the people at the urgent care tell you?
Well, they did what they could. They took an x-ray actually, and all they could see on my left side was a large mass. And when I looked at the x-ray, it actually just looked like a cloud, covering where my kidney should be, that left side of the intestine. It was just a cloud. It really kind of baffled everyone. So got referred to my primary care the next day for further evaluation.
By the way, if you like what you hear on this segment, we invite you to subscribe to our podcast by checking the links below. Once there, you will see a bell icon. If you click on that, we will notify you when we post a new interview. Now, Marissa, what was the next step in your quest for information to find out about this mass?
Well, went to see my primary care the next day, and she took a look at their report, and that afternoon went to get an ultrasound. It was very worrisome to her what it could be. From that ultrasound, it was determined even that day, I think it was, or maybe the next morning, that it wasn't good. Something that large shouldn't be there. I was in my late 30s at the time, and so it really was not normal. That kick-started off about a 10-day whirlwind of referrals and tests, and really kind of got the process going to figure out what it was and what the next steps were to take care of it.
I can only guess that if it was concerning to your healthcare professional, it would be very concerning to you.
It was, especially because I felt wonderful. I didn't have any of the typical symptoms of kidney cancer. I wasn't having any pains. I wasn't tired. I was losing weight, but that was, again, due to just a change of diet and exercise. No blood, no symptoms whatsoever of your typical kidney cancer people.
And just for the education for those who have just been diagnosed or have been told that they could be a candidate for kidney cancer, what are some of those normal symptoms?
Some of the more normal symptoms are things like blood in the urine that can be found, excessive tiredness or fatigue, unexplained weight loss, flank pain, which kind of on, either side or even towards the back. Those are just a few of the symptoms. Unfortunately, sometimes those symptoms can be symptoms of a lot of other ailments, but if someone is having any of those, very much worth getting checked out and visiting with your doctor about them.
Now, let's get back to your chain of events. What was next after this last step?
After the primary care, I got referred to the University of Kansas Medical Center, which is here in the Kansas City area. Fantastic group, and I've been with them ever since in my care. Got referred there, and that started a myriad of tests, CTs, bone scans, lots of blood work, of course, and just test after test until they realized it was, they couldn't do anything until it was officially out, but they could see the mass on the kidney, and it was almost encapsulating my kidney by the time that my kidney and the tumor were removed. From the time I talked to my primary, surgery was 2 weeks later to do a radical left nephrectomy. So that included my entire left kidney, the tumor, of course, itself, and the adrenal gland that was sitting on that kidney, because it was almost covering that as well.
So I just want to be clear. Were you told that you had kidney cancer prior to the mass's removal or after?
I was officially told after, but prior to, it was very likely that was the cause. But of course, they couldn't give me 100% certainty until the mass, the kidney, were removed and pathology was done. But once I had my nephrectomy, found out about 5 days later that it was confirmed that it was a stage 2 kidney cancer.
So was there still a matter of treatment, a treatment regimen after the removal?
At that time, no. At that time, I was declared free and clear. There were no other signs, nothing else showing up in my body at that time. When they removed it, I was clear.
So, a theme that we hear from, a theme that pertains to every type of cancer, even though each type of cancer is a bit different. The one theme that we hear that we want to emphasize is that of early detection. And it looks like early detection was your friend in this situation.
It was. It definitely was. And I think the biggest part of that was just being aware of my own body and trusting it. I knew something didn't feel right, and just going with that gut instinct. I could have kept about my daily life and not gotten it looked at, just because it had been there since it was stage 2 already. It had been there quite a while, a number of years. Actually, the urologist said it had probably been roughly 5 years, they think, just because my type was a slow growing.
So if I'm hearing you correctly, it sounds like the toughest part of your treatment was just the removal of the mass.
Well, that treatment, yes. But once I got the removal done, about 9 months later, it did come back. And resurfaced again in a checkup. We, once diagnosed, there are follow-up visits, and that's something you have to be really good about going to those follow-up checkups. So this was at a checkup, had normal, x-ray done and things, because they want to look at not only the site where the kidney was, just make sure there's nothing around it, but kidney cancer likes to go to other places. And one of those places is the lung, and that's where my metastatic disease was found, was in the right lower lobe of the lung. Just a couple nodules showed up on an x-ray, and for myself, they decided just to do an observation on me. They were so small, less than a centimeter, so just some observation and evaluate every few months to see if it progressed.
Marissa, with different guests we've had, some of the guests we've talked to have had a recurring situation in which it looks like the cancer had been sufficiently addressed and then it came back. And that puts the patient at kind of a crossroads mentally and emotionally, because
Mm-hmm.
either they can say, well, I've survived this once before, I can survive it again, or this was so devastating the first time, it's doubly devastating the second time. How difficult was that for you when you found out that this was coming back?
It was difficult, but honestly, I wasn't surprised. Just because of the size of the tumor that they took out initially, they were great and very upfront and honest that, it can come back. And there's a likelihood it probably would. It could have been months, as in my case, may have taken years, but they were very honest with me that it could probably return at some point in time.
Now, you had talked about your active lifestyle. How was your active lifestyle compromised if you had one good kidney?
For me, it was just taking a little bit more care in my diet. I worked with a dietitian there at University of Kansas, and the main thing I was told to do was just watch sodium and proteins. So luckily that wasn't a huge stretch for me. Was trying to stay away from salty foods, just to have a good diet. Proteins, a little bit more modification, but luckily it really didn't, as far as my diet, restrict anything that was too much different than what I was already doing. As you said, I was active, so just during recovery from surgery, that definitely took a little more getting used to get back into being active again and exercising.
Now, we talked about the common thread of early detection. I want to ask you about another potential common thread. Each kidney cancer journey is its own entity, but would you say for those who are on a kidney cancer journey, diet is really important?
I would say it can be important. In my case, diet really probably didn't have a lot to do with my getting the cancer. But it definitely is important just because of, for me, like the sodium part. Just watching that after diagnosis was and still is something important that I need to watch.
Now, through this difficult time, what was your source or sources of support? You've mentioned family and friends. I suspect they would have been a great source of support.
Oh, they were and still are. I lean on them when I need to. My husband, friends are just fantastic, and have most of them been with me these last 9 years, the whole journey to where I'm currently at.
Now, I want to mention not a family member or a friend, but an organization, although I suspect the organization could be a friend, and that's the Kidney Cancer Association. How did you cross paths with the Kidney Cancer Association?
Well, initially when I was diagnosed, I did something that probably a lot of folks do when they get their diagnosis of whether it's kidney cancer or any kind of cancer, is go on the internet, which can be a good and a bad thing. But in this case, it was very good to find Kidney Cancer Association. They were, online when I was looking for them and looking for resources about kidney cancer. There were some good things on there about just being a new patient, about diagnosis, about things to expect, treatments. Then actually last year, so fast forward a little bit, am now a member on the Patient and Caregiver Advisory Council. Applied for that and have been a part of that, and really am just enjoying getting my story out there and doing what I can to help them with education and advocacy.
I would think, Marissa, that we've talked to a lot of caregivers as part of this podcast, but you are uniquely positioned to be a caregiver for somebody on a kidney cancer journey because you've been in their shoes. How much does that help?
It helps a lot. It really, I think, if I'm in that position to help them and, understand what they're going through. And, if down the road, if I have a family member or a friend, that has to go through the journey, I think just being able to empathize with them, but also help them advocate for themselves and get the treatments, that they should, get a second opinion if needed, just help them, step by step and what they should expect and take from everything.
Do you, when you're serving as an advocate, do you deal with people in person in and around Kansas City, or in this internet Zoom-driven age, have you been known to advocate with other kidney cancer patients elsewhere in the country or even outside the country?
Well, it's just internet based. I have Twitter and Facebook under KC Cancer Moms, my name on there, and I've had a few people message me and just visited with them via internet, via messaging about their journeys.
And is your help mostly informational, or can it sometimes be emotionally driven, because this is a very stressful time for somebody going through cancer?
Mostly informational, but can definitely understand the emotional side of it. Everyone takes that journey differently, and how they look at it. It depends a lot on their staging, their lifestyle, where they're at in that life when they get that diagnosis.
Now, you have the recurring nature of your diagnosis, but it looks like, for the most part, Marissa, from a distance anyway, it looks like for the most part you've gotten the upper hand on this. How exciting is that?
It's very exciting. Again, working with my medical team, they have been fantastic. They've got me on a treatment right now that's kept everything stable. So I'm very, can't be more grateful to them. And it's helped me to still keep an active life, keep doing what I want to do, travel and do things with family and friends, and just, enjoy life. I've got the metastatic disease, but it's not stopping me really too much from doing what I want to do.
Now, you mentioned your care team, and something that we hear from some of our other guests is the significance of finding a care team that you trust. It sounds like that's the way you feel about your care team.
It is. It is. They've, helped me this last almost 9 years now, and given me options, helped educate me through those options of different treatments along the way. And, together we've found something that's working for me, that's really, really helping me live that full life.
Our guest is Marissa Willis of Blue Springs, Missouri. She has survived kidney cancer, and she's helping others who are battling kidney cancer. Marissa, we're about ready to wrap up. And when we wrap up, we always like to end up at the same place. Let's pretend that you've just encountered somebody who has been freshly diagnosed with kidney cancer, and you have a private audience with them, and you want to get a message across to them. If there's any one overarching point that you would like to make with that person, what would it be?
I think when you first get that diagnosis, take a deep breath, take a step back, and really rely on those closest around you, whether it's family, friends, coworkers, whomever it is. Really get them on your corner. You're going to need them. You're really going to need them. And then next, look at your care options. Talk with your primary or whomever it is you got the diagnosis from, and ask questions all day long. You should have a team that doesn't stop you from asking questions until you're done asking. Use their time. That's what they're there for, to get you through this. And then, lastly, go out, like I did, look for things on the internet with caution. But if it was kidney cancer, KCA is a wonderful resource. They have a, just diagnosed toolkit on there, and just so many stories like mine and others that can really help and provide some good information.
Okay, wonderful, Marissa. Thanks so much for your two-pronged bit of information regarding your story. First of all, with your cancer journey and the way in which you are helping others. We have no idea how many people appreciate what you bring to the table as far as this goes. And some of them might be in our watching or listening audience. So Marissa, once again, thanks so much for your time.
Absolutely. Thank you. Glad to do it.
And that's going to wrap up this edition of Cancer Interviews. We want to remind you that if you are on a cancer journey, that you're not alone. There are people out there to help you, just like Marissa. So until next time, we'll see you on down the road.
Thanks for joining us today. For more information, please visit us online at cancerinterviews.com. We appreciate you tuning in, and we'll see you back here again next time on the Cancer Interviews Podcast.